Just a little background about me. I was in practice in Nebraska for 12 years. I did grow up in Georgia. I got my master's of science in animal science at the University of Georgia in '87. And then went from there to Texas, spent some time in Texas, then went to Colorado and worked for Dallas Horton and his companies. And while I was there, I decided it was a better way to make a living and went to vet school and graduated from vet school in '98, practiced in Nebraska for 12 years and worked alongside guys like Dr. Moore and then I came back to Georgia and I took my predecessor's position, Dr. Mel Pence, who's now with in Arizona, helping with that startup vet school. And as you know, as Mel would say, that a lot of people called him Dr. BVD or Dr. Yonis. And he did a lot of work in Georgia, running around and talking about the value of testing for BVD and the impact of BVD in cow-calf herds. So my position with the Tifton Veterinary Diagnostic Lab is kind of a case coordinator or a case investigator, a field person. I'm also with the College of Veterinary Medicine, so I'm a clinician, and I do work with students. I get 5 rotations, and we work out in the field mostly. We don't do much classroom work. I have an extension component. The joy of my job is I get to wear multiple hats. The aggravation of my job is that I get to wear multiple hats. So it's sometimes it's a jack of all, master of none. Anyway, where are we? And I hope you can see this. A lot of times we think in terms of this direction. We're gonna just make a straight line to our goals, and when in fact it's back and forth all around, and a lot of it looks a lot more complicated. This picture over on the left, and I tried to change the lighting a little bit. This was I went to a guy's farm, and he was buying 7-weight bulls to start with, and he was wondering why he was having problems. Buying the cheapest things that came through the sale barn and adding value. When I went to Georgia, talked to some buyers, some cattle buyers, order buyers, stocker brokers, and I asked them, I said, well, what do you do? And they said, we fix cattle. They take mismanaged cattle, upgrade them. Now they have a new term, upgraders, but that's what they did. And so we dealt with a lot of respiratory disease and a lot of issues. Thank you, Sandy, for doing a great job, and hopefully mine will build on that. Well, when you look at the justification for BVD eradication, obviously we're going to decrease morbidity. It's known, as what Dr. Lonergan showed. If cattle are exposed to a PI calf, their need for treatment increases. So we're going to have decreased mortality. With the current inventory, every calf matters. We really can't afford to lose cattle, beef, to something that's preventable. And BVD really is. Like trick, we know what causes it. And why we can't get our head around that and get producers on board sometimes, I scratch my head. That's what happened up here. But if we get rid of BVD, we're going to increase production. And of course on the cow-calf level, that's important because every phase of the beef industry has a different economic driver. It's reproductive efficiency at the cow-calf level. It's improving or upgrading, adding value to that calf at the stocker level. It might be weight, it might be health. And then at the feed yard level, it's efficiency of getting them to finish. And BVD impacts every level of that in a different way. I missed the fall meeting in Atlanta on antimicrobial stewardship and antimicrobial use. But if we are, and I read the white paper, great job, if we're going to reduce and refine antimicrobial use in the United States, one of the things we're going to do is get a control on pathogens. It's just that simple. BVD increases our need for antibiotics. And if we can reduce BVD in the herd, we're going to reduce our need for antibiotics. We're going to reduce our need for metaphylaxis. Really and truly, eradicating BVD is just part of many things. It's part of increasing overall herd health at the cow-calf level. And I'll talk a little bit about the state of Georgia. I do appreciate the fact that you've got Southeasterners. Kentucky is in the SEC, and of course we're proud of them during basketball season. But and of course improved herd performance, and we've already heard that at the farm level. And just a little bit about beef production in the state of Georgia. We've got about 15,000 farms with beef cattle. I don't call them ranchers. I don't call them all farmers. A lot of them are hobby people. There's roughly 400,000 beef cows. Now, we're down. We had a drought in 2007, 2008, and a lot of guys got rid of their cows. And then they realized they could live without them. Never repopulated. So we're down. There's about 245,000 calves sold through Georgia sale barns. Now, I know you just did that math and you think, wow, 60% reproductive efficiency. What happened is that a lot of producers the value-added presentations and education program took with a lot of producers. We're selling almost 100,000 calves through satellite, other means versus livestock markets. So this only represents about 250,000 calves coming into other phases of production elsewhere in the nation. But a lot of calves have already gone through value-added sales. So a lot of people have seen the value and done things like a herd program, done things like BVD testing, those types of things. They've taken advantage of it, and we still got a population of people who still use the livestock markets as their primary means of marketing. Stocker operators, we do still have some grass in the southeast. When cotton and peanuts and timber are definitely a lot higher, but every once in a while when cotton goes down, people think about putting their pivot back into grass. We do have some purebred and seed stock operations. And then dairy is about 15% of the beef source, but we've got just really a little less than 100,000 dairy cows in the state of Georgia. What are our challenges in the state of Georgia? And I'm sure these are similar in other places. But we've got active and passive owners. Active owners, I kind of categorize them as owners who have an expectation on their cow herd. They see their cow herd as part of their portfolio, if you will. And I think this could be really valuable, especially now. Part of my extension job is to talk to owners, and I help them do the math. A person with 50 cows can pay for 2 of their grandkids to go to college. There's a lot of value right now. We can get the profit margin off of 1 cow in 1 year now. What we used to take is 10 years, 8 to 10 years. And so there's a lot of potential for improving your financial situation with a handful of cows with really minimal inputs. We're not asking them to do a lot. A few days of the year, put some input. We got passive owners. They treat their herd like a savings account, and they just kind of make periodic withdrawals. And of course, I guarantee that money does perform better that way than a savings account at the bank. But nevertheless, these guys, what we want to do is we want to take passive owners and move them up to active owners. And how can we do that? We really want to sharpen their appetite. We want to increase. We want to do something to get them to be hungry for a better level of production. Lack of local data. Okay, now I'm in academia, so always, whenever someone asks me a question, what's the first 2 things that come out of my mouth, Carla? It depends. I don't have data. I can't make a decision. Back before I was in academia, I could tell you something with a limited amount of data. Now I can't. What's the prevalence in Georgia? Well, according to a report from the Association of Veterinary Laboratory Diagnosticians in 2007, they said it's 0.14%. Well, that was only about 4,100 tests, 2005, 6, and 7. So very few. Not enough really to get a good prevalence of BVD in the state of Georgia. And that was mostly antigen tests. We don't really know what producers know. We don't know what we don't know. We don't know what they don't know. And then that was brought up too in the question answer. How can we make producers care? The ones that don't. The ones that need to be motivated, incentivized, whatever. So our education objectives are to increase awareness, and then, of course, that awareness has to be active, has to increase activity. And I would like to see this done all under the veterinary client-patient relationship. Everything I do is to try to encourage, enhance, enforce, and I practiced in Nebraska for 12 years. I saw the asset. Some people consider veterinarians a liability. I consider veterinarians assets. I want to move them on the other part of the ledger, where I bring information and I bring value. David Welch with AABP has some seminars about delivering value to the farm, the value proposition. And I think this is something that veterinarians can do. Working with gold standard labs. Just because I work with a diagnostic lab doesn't mean I don't value other labs, but we need to kind of form this teamwork approach and realize that we've all got a dog in this hunt. Sorting out the data. I got this chart from Dr. Bill Hessman, and really and truly, we really don't have a lot of regional prevalence. But Dr. Hessman found that they were rocking along from 2005 to roughly 2012 or 13 at roughly a 0.4% prevalence. Something happened. Pretty much the redistribution of animals in the United States, and we spread things. Now, we want to thank y'all out west for anaplasma and trich and BVD, because we didn't have much of those issues. But we've diagnosed quite a few of all three of them, more so in the last 2 to 3 years with the movement of cattle. And, of course, they all got moved with the proper health papers. I hope you appreciate my sarcasm sometimes. It's meant to be humorous. And this was also brought up in the Q&A, in the conversation. Producers may be motivated by loss of market or market discounts more than premiums. You know, and we talk about a $14 premium, but a $14 premium on a $1,400 calf is only 1%. So if I can't get them to vaccinate and castrate and take advantage of a 25-cent premium on a steer versus the bull, I'm going to have a hard time getting them to take advantage of a $14 premium. So what you know, and I'm not the best study in human nature, but we just need to feed them some salt, get them thirsty. Recent South Georgia cases. I know 2013 isn't recent now, but I just want to share a few things to illustrate this issue in Georgia. And is there any water nearby? Thank you, Charlie. In Adel, Georgia, I had a farmer call one morning, and he said, Dr. Jones, I called so-and-so, and he told me to call so-and-so. Another guy said, well, call so-and-so. He'll definitely help you. And so he called, and he wanted to get into cattle. Thank you, Dr. Hatcher. He wanted to get into cattle, and he bought 17 heifers from his dad. And he had a nice little place out there. And I went out there, and they were sick. He had lost 2. And so I said, well, we need to look at them. They looked wormy, and they appeared like they might be a PI in there. They were kind of scraggly looking. So we finally got them worked, and we got them tested. 5 of the 15 heifers were positive by ear notch, ELISA. Okay, so they're not all PIs for sure, but they've definitely got BVD going through there. We went ahead and worked them, and I advised him to retest in 4 or 5 weeks, and contacted him, and he had picked the prettiest one out of the 5 and then marketed the other 4, unfortunately. But he had gone back to his dad and said, when I got those heifers, I also got BVD. But Dad said, I don't have BVD. I don't have any problems. That's the insidious nature of BVD, isn't it? Producers don't often recognize it because it did not create the problems at his farm that it created at his son's farm. And that's a good example, I think. In Claxton, referral veterinarian contacted us. The owner wanted to know he's got 45 cows and only 16 calves, and then he had 3 PIs. These were, in fact, PIs. Dairy calf raiser in South Georgia found some PIs. He buys calves from 4 producers, all of them 800 plus in the milking string. A couple of them are over 2,000. And he'd been rocking along fine. He started noticing pink eye, recurrent pink eye. Pink eye spreading along the hutch line. And recurrent pneumonia. Get them over it, they come back. And he was dealing with some, finally he started looking, and he'd found some BVD infected PI calves in there and went to the different farms, and one of the dairies had purchased a bunch of replacements, and all this coincided. They actually found it in their milking strain. So here's a situation where things had been fine, and someone brought in some replacements, and then it worked its way down the line to the dairy calf raiser. And then we had a bison herd. Had calf loss, low calf production, and a few blind calves. And he had BVD. So it does work in other species as well. I just want to share a few tests, some data from the diagnostic lab, and we've had some problems recovering data, and right now we're moving to the new veterinary teaching hospital, so some of our IIT people weren't available. And this is definitely not all the tests that we do. We still do SNs, fluorescent antibody, viral isolation. We do quite a few tests. I think there was about 12 different categories of tests, including immunohistochemistry, ELISA, PCR, some of the antigen tests. But in year 2010, we did about 2,400 antigen tests, and the incidence was about 0.8%. 2011, we did fewer tests, and I'll discuss this, and it was about almost 1%. 2012, this would have been almost 1,200 tests, 1.36, 1.4%. 2013, 1,000 tests, 0.8%. 2014, our test numbers are going up, and we were at 1.3%. The reason they're going up, Dr. Mel Pence, I came in 2010. Dr. Pence left in 2009. Our testing, while he was there with a lot of education, was a lot higher. He was keeping it in front of producers. Now, I don't know, a couple of things could happen here. Either we finally reached a group of producers and maybe they have gone to surveillance testing now, just monitoring, and they're using people like Gold Standard Labs, or maybe we need to go back and revisit some education and try to increase. 2013, we realized that we really were not in the game as far as providing a lot of monitoring surveillance services. And we upped our game, changed our submission process, made things more friendly. As a matter of fact, we've developed and copied people like Sandy and developed kits to send out to producers, because we have a lot of small producers, a lot of small folks who may not, who may not have the numbers to send in big groups of submission or samples. And so we're trying to reach out to them. Plus, we're also trying to work with a local referral veterinarian. And we've educated them, just had a food animal conference in Georgia this past weekend. And we're trying to do things to provide more service and more information to our area producers. We're not in competition. We're not a for-profit lab. We're out for service, and that's our main goal. And so we're trying to reach out and do other things, there's a great service that Gold Standard and other labs are doing, but we're trying to get on the farm. Post-market testing just really hasn't gotten the job done as far as reducing the incidence of BVD. Owner education, obviously past articles presented the worst case scenario, BVD. We talked about the fulminant disease and not the insidious nature, the subtle nature of BVD. BVD doesn't always present with severe symptoms. We're still dealing with lack of records and lack of controlled breeding season. And both of those increase the risk of having BVD in the herd. Not having the controlled breeding season means if I've got a PI, I've got calves exposed constantly at a critical time. Lack of records, I may not be able to pick up on the fact that my reproductive efficiency is subpar. Owners are more motivated in this cattle market. And we can reach out to them and talk about this will not last forever. And it's a good opportunity to take advantage of this market right now. So, the cow-calf, typical BVD, causes an absence of the calf. And this picture, I apologize, this picture really shows a cow-calf nursing, but the calf is shaded out. He's not there. If I don't make something, I can't sell something. So some of the solutions, education programs, something in what I do, collecting good local data, valid testing. And we know that Dr. Edmondson and others at Auburn sent out those tests in 2000, 2006 and reported it in 2007. And there were some of the labs that were actually below standard, reporting. As much as 26% of those labs were missing PIs. And I have found PIs behind some tests, some in-ear notch cattle. So it does still happen. Reliable test kits, we did find that some of these test kits were running invalid. We have 2 labs, and we have board-certified virologists, and we actually found that some of these kits were not as reliable, and fortunately, they were producing a few more false positives, but the controls were overlapping, and they were not as definite. And then data sharing. Proposed studies. We've done these proposed studies, and I'm running short of time, and I won't talk necessarily about that, but some of the things that we want to do is try to sample, determine prevalence in the state of Georgia, and improve producer education. In summary, we really don't know still what we don't know. We know that we don't know, so we're on our way. We're making progress. We don't really have any local stats to know where to benchmark. National data, we possibly are heading in the wrong direction. And some owners don't appear to be motivated by premiums, although more owners are definitely paying more attention to unproductive cows during this high market.